Good evening. I want you to stop whatever you are doing right now and listen carefully, because there is a hidden reality about aging that almost nobody talks about clearly enough. There is a small organ deep inside the body that can begin struggling silently for years before anyone recognizes the pattern, and the warning signs rarely appear dramatic in the beginning. They look ordinary: fatigue, digestive discomfort, weight loss, pain after meals, changes people dismiss every single day as simply getting older. But sometimes these symptoms are connected in ways that are critically important to understand. I want to tell you about 3 different people. The first was a man in his late 60s who came into my office looking deeply exhausted. Not the kind of tiredness that follows a busy week or a poor night's sleep. This was different. He described it as a heaviness that stayed with him from morning until night. Over 4 months, he had also lost nearly 12 pounds without trying. He blamed stress. He blamed aging. He assumed his appetite had simply changed with time. Nothing about his symptoms felt urgent enough for him to ask deeper questions. The second was a 64-year-old woman who had been quietly dealing with digestive changes for almost a year. Loose stools, oily stools, a strange smell she could never fully explain. She felt embarrassed discussing it, even with her own family. She convinced herself it was probably something minor. Perhaps probiotics would help. Perhaps more fiber. Perhaps her digestive system was simply slowing down with age. But nothing changed. The symptoms remained, quietly, consistently. This video is made for your benefit, so quickly like the video and subscribe to the channel. The third was a 71-year-old man whose main complaint was pain beneath the ribs, sometimes spreading toward the back after meals, especially after heavier foods. He thought it was reflux. He carried antacids with him constantly. For months, he treated the symptom without ever questioning the source beneath it. 3 completely different people. 3 completely different complaints, yet all 3 were connected by the same organ, the pancreas. Most people never think about the pancreas unless they hear the word diabetes, but the pancreas is doing 2 critically important jobs every single day, and after the age of 60, subtle changes in those functions can begin affecting the body in ways that are surprisingly easy to overlook. My name is Dr. Matao Jamee. I've spent the last 12 years working primarily with adults over 60 because this stage of life fascinates me. It is the stage where the body begins speaking in quieter ways, less dramatic, more subtle. The problem is that most people have never been taught how to interpret those signals correctly. They silence the symptoms before they understand the message underneath them. The pancreas sits quietly behind the stomach, roughly the size of a fist, yet its responsibilities are enormous. First, it produces digestive enzymes that help break down fat, protein, and carbohydrates from the food you eat. Without those enzymes, food enters the body but cannot be properly absorbed. Nutrients pass through incompletely processed, leaving the body undernourished even when someone appears to be eating normally. Second, the pancreas produces hormones like insulin and glucagon, which regulate blood sugar. When that system becomes unstable, energy levels begin fluctuating, concentration changes, blood sugar swings begin silently affecting nearly every organ system in the body. What makes pancreatic problems particularly dangerous is that the organ rarely fails all at once. It whispers first, and those whispers often disguise themselves as ordinary aging. One of the earliest warning signs involves changes in stool, not occasional irregularity. Everyone experiences that from time to time. I'm talking about consistent changes that persist for weeks or months. Pale stools, greasy stools, floating stools, stools that become unusually foul-smelling or difficult to flush. These changes matter because they may indicate that fat is no longer being properly absorbed. When the pancreas stops releasing enough digestive enzymes, fat passes through the digestive tract incompletely broken down. Doctors call this statorrhea. It is not a pleasant symptom, but it is an important one, because fat does more than provide calories. Fat carries vitamins A, D, E, and K. Without proper fat absorption, deficiencies begin developing slowly over time. Bone weakness, muscle loss, poor immunity, vision problems, dry skin, symptoms many older adults simply assume are part of aging. The woman I mentioned earlier had been living with these symptoms for nearly a year before seeking help. By the time we evaluated her properly, she had significant vitamin D deficiency and measurable protein malabsorption. She was eating adequately. Her body simply could not extract what it needed from the food she consumed. The second major warning sign is upper abdominal discomfort after meals, particularly after rich or fatty foods. This symptom gets mistaken for acid reflux constantly. The pain often appears beneath the ribs and may radiate into the back. Sometimes it feels dull and persistent. Other times it feels like pressure. It usually appears 20 to 40 minutes after eating and can linger for hours. Here's the hidden connection most people miss. Eating stimulates the pancreas to release digestive enzymes. If the organ is inflamed or under strain, that stimulation itself can provoke pain. The body begins associating meals with discomfort, particularly heavier meals, requiring greater digestive effort. The man I mentioned earlier noticed that barbecue, cheese, and fried foods consistently worsened his symptoms. He assumed he was simply becoming more sensitive to rich foods with age, but the pattern itself told a deeper story. Another warning sign that concerns me deeply after 60 is persistent fatigue. Not ordinary tiredness, not stress-related exhaustion. I mean a heaviness that seems to settle into the body and remain there despite rest. Many older adults are told this is simply part of aging. Sometimes they are handed vitamin supplements and reassured without anyone investigating further. But fatigue connected to pancreatic dysfunction follows a different physiology. If digestive enzymes are impaired, nutrients are not properly absorbed, cells receive less usable fuel. At the same time, unstable insulin production can create blood sugar fluctuations that affect the brain, muscles, and nervous system. The result is a type of exhaustion that feels deeper and more persistent than normal fatigue. I remember something my father used to say. He believed that whenever something continuously takes your energy without giving it back, you must stop and ask why. I have found that the same wisdom applies to the body. Persistent exhaustion deserves curiosity, not dismissal. Then there's unexplained weight loss. This is one of the most clinically significant symptoms we see in medicine after the age of 60. If someone begins losing weight without intentionally dieting or increasing physical activity, that deserves attention, especially when it appears alongside digestive symptoms or fatigue. When nutrients are not properly absorbed, the body begins consuming its own reserves. Muscle mass often declines first. Appetite also changes because eating itself may become uncomfortable. People unconsciously begin avoiding heavier meals. Portions shrink. Foods they once enjoyed quietly disappear from their diet. Over several months, weight begins falling steadily, often before the individual fully notices how much has changed. The final cluster of warning signs includes nausea, appetite loss, and changes in blood sugar, increased thirst, frequent urination, blurry vision, feeling shaky between meals. These symptoms may indicate that the endocrine function of the pancreas is becoming unstable. This is particularly important because new-onset diabetes after 60 is not always traditional type 2 diabetes. In some cases, it may reflect a condition known as pancreatogenic diabetes or type 3C diabetes, which remains significantly underdiagnosed. Again, the body is presenting clues, quiet clues, but meaningful ones. I want to be very careful and responsible here. None of these symptoms alone automatically means something is seriously wrong with your pancreas. Fatigue has many causes. Digestive symptoms have many causes. Weight loss has many causes. What changes the picture is the pattern, the clustering, the persistence over time.
If 2 or 3 of these symptoms are appearing together, particularly over several weeks or months, that combination deserves medical evaluation, blood work, imaging, a careful clinical conversation, not panic, not fear, simply attention, because many pancreatic conditions are manageable when identified early. Chronic inflammation, enzyme insufficiency, gallstone-related complications, even significant pancreatic disorders often have far better outcomes when caught before advanced damage occurs. The patients who tend to do best are rarely the people with perfect medical histories. They are the people who paid attention early, the people who recognized that their body was trying to communicate something important and chose not to dismiss the message. The pancreas is a remarkably quiet organ. It does not usually create dramatic symptoms in the beginning. Instead, it speaks indirectly through fatigue,